I'm pleased to be joined today by Dr. Stephen Hahn, Commissioner of Food and Drugs at the U.S. Food and Drug Administration. Commissioner Hahn was sworn in on December 17, 2019. He is a physician, scientist, and healthcare leader with an extensive background in patient care, academic research, and executive leadership. Commissioner Hahn's specialty is treating lung cancer and sarcoma, having most recently served as the Chief Medical Examiner at the widely known MD Anderson Cancer Center. Commissioner Hahn completed his residency in internal medicine at University of California, San Francisco, and studied medicine at Temple University and earned his bachelor's in biology from Rice University. Welcome, Commissioner Hahn, and thank you so much for joining NASDA's annual meeting.
Thank you, Dr. Glenn. It really is a pleasure to be here with all the membership and you of NASDA. We very much enjoy the relationship and the collaboration we've had, and you've really been terrific partners, particularly in our food safety efforts.
Well, thank you so much. And as you will recall, we last spoke in February when you were newly appointed in your role. And since that time, everything has changed for both FDA and certainly for state departments of agriculture as well. The challenges for food and ag exceeded what anyone could have imagined. So how are you managing since this time?
Well, clearly it's been a challenging time for everyone. I was just beginning to learn about FDA when COVID-19 appeared in the United States. I was appointed a member of the White House Coronavirus Task Force, and a lot has happened since that time. One thing I can say is FDA's commitment to science and data and medicine is unwavering. I've learned that about my colleagues at FDA, that they similarly have that commitment. And one thing that I think is really important for folks to know is that during this time, we had our regular work that we've always done at FDA, but we've had approximately a doubling of that work based upon applications and issues that we've addressed during COVID-19. So I'm incredibly proud of the work the agency's done. I think we're in the process of looking back to see what we could have done better, what we'd like to keep and to institute on a permanent basis. But one point that I think you brought up that's really important, I think for all of us is, although incredible stress during COVID-19 on the food system, but it did show the resiliency of the food safety and the supply system in this country. And really, thanks to many people, including folks in NASDA, in terms of helping with that resiliency, in terms of helping us get through this crisis. Our team told me at one point that the stress on the system was similar to 7 Thanksgiving holidays, which of course is one of the biggest sort of inputs of food in our yearly approach to food. And so when you think about 7 of those put together during a time of a national crisis and the resiliency we have in the food safety system and the food supply system, pretty remarkable. Now, we know we have things that we need to do to get better. We know we have things that we need to do to improve how we approach food supply and security and safety. But I would say that the system worked remarkably well under very difficult circumstances.
Well, thank you so much. Yes, resiliency is a key term, and you described well what the agency went through. On behalf of NASDA's membership, just let me take a minute to thank you for your science-based leadership during these unprecedented circumstances. So thank you so much.
You're welcome.
So with the recent release of the New Era of Smarter Food Safety Blueprint, FDA is recognizing the critical role technology will play in food safety. How do you see the blueprint guiding FDA's work in the future, and where do states and territories fit in?
This is a really important step for all of us in food safety. First of all, NASDA partnered incredibly closely with us on the Food Safety Modernization Act, otherwise known as FSMA, and it has continued now with the New Era of Smarter Food Safety. We can't do what we would like to do with respect to food safety and security without the partnership with NASDA. And so I want to start off by thanking you for that. The New Era is really part of our approach to modernization. Across the agency, we're interested in modernizing our approach to all medical products, but in this particular case, food and food safety. We want to leverage technologies to have a more traceable food system. We want to leverage technologies like artificial intelligence and machine learning so that we can better target our resources to those areas of the highest risk, and maybe approach it in a more efficient and more, if you will, a smarter way of getting to where there might be problems in the food system. And I think the other thing that's really important that we very much valued the partnership with NASDA is around food safety culture. And that is, how do we get to a better place with food safety culture? We all share that. And one of the things that's really amazed me about industry, as well as with NASDA, is that everybody is interested in food safety, and we all have a part to play in this. And that partnership has been very real and has helped us initiate the new era.
Yeah, well, thank you so much for those remarks. The emphasis on science-based technologies for food safety doesn't stop there. In fact, as you know, it goes from farm to fork. So NASDA is involved along the journey for this new food safety culture. And I would be remiss if I didn't do a shout out to thank Deputy Commissioner Yanis for his leadership with respect to our partnership with you in this regard, and on FSMA implementation. So thank you for that. And we're ready to stand with you and build out this blueprint. So thank you.
And I want to echo what you said. Frank Yanis is a terrific deputy commissioner. He is so focused, laser focused on food safety, the supply chain. He brings incredible talent to the table here. And he's been a terrific partner for me at the agency as we talk about these issues.
Yeah, that's great. Okay, we'll shift a little bit here. Protecting workers in the food and agriculture supply chain has been critically important during the COVID-19 pandemic. And indeed, NASDA quickly urged prioritization of PPE for the food and ag critical infrastructure. In particular, we called out the needs for agricultural workers on the farm, and that included field workers that are harvesting fruits and vegetables. So could you share with us some details about what FDA's been doing to help ensure worker safety during the COVID-19 pandemic?
For sure, Dr. Glenn. So particularly under Frank Yanis's leadership, we have had a bidirectional conversation with all stakeholders involved in food safety, food worker safety, as well as the supply chain. And really, they're very much connected. Supply chain and maintaining a supply chain and a secure food supply is very much dependent upon food worker safety. And so making sure that we understand what the issues are with industry, with NASDA, and for the workers, and then coming back and working with our federal partners and you in terms of trying to get to the right place to provide the appropriate guidance has been a critical part of what we've done during the pandemic. We've pushed a little bit the boundaries of what FDA normally has done, but we partnered with OSHA as well as with CDC to develop some guidances for industries. And those guidances really talk about things like, how do we test individuals? If there's an outbreak, what do we do with respect to contact tracing so that we know the extent of it? When we talk about the common sense public health measures of mask wearing, social distancing, hand washing, et cetera, how do we make sure we implement that in a variety of different settings, meat packing facilities, other food facilities? How do we make sure that we have practical approaches for industry to use to protect the safety of food workers?
Yeah.
We've gone as far as to talk to folks about housing situations and how that might affect food worker safety. And so we've really leaned into this in partnership with NASDA, with the industry and OSHA and CDC to provide some practical guidance regarding the approach that should be used during COVID-19. And of course, it's really important to remember, Dr. Glenn, that the virus is still with us. These measures, these common sense measures, are our path forward. Really important for us to continue them. And we will continue the bidirectional dialogue to try to help as much as possible to make sure that the appropriate measures are in place to protect food workers.
Well, that's absolutely great to hear. And yes, thank you for stepping out and leading in this particular area. Our members are dealing with this right now. It's a key issue. Protecting our workers in the agricultural supply chain is a top priority for NASDA. So thanks so much for what you're doing. Let's keep working on that together.
Yes, ma'am, you got it.
So I have one last question for you before you go. And hopefully you can help us out here. What can you tell us about the development of a COVID-19 vaccine? There's a lot going on, and I respect that very much, but also just respect if you could sort of share with us your thoughts at this time.
Yes, for sure. So there are a number of phase 3, those are the final clinical trials looking at the safety and efficacy of a vaccine. And those trials are ongoing. They are looking at 2 vaccines, and we expect additional vaccines to go to phase 3 trials in the United States. And a variety of other vaccines are in earlier stage clinical trials.
Mm-hmm.
And these trials will give us data that will then be given to the FDA. Our job at FDA is to look at those data when they're available, and to make a judgment about the safety and the efficacy of that vaccine. One thing I can promise the membership of NASDA and the American people is that we will use our high standards to assess the safety and efficacy of a vaccine. We will not cut corners, and we will make the absolute best decision to the benefit of the American people. Now, in June, we issued some guidance about what would be the appropriate parameters around safety and efficacy that we would need to see with respect to a vaccine. We wanted to provide regulatory clarity. And in addition to that, we're being very transparent about the process. We've already scheduled what's called a vaccine advisory committee, where we'll bring outside experts to look at any data that we might receive. Now, we don't know when we're going to receive those data, so we're really dependent upon the trials being completed and for those data to come to us. But when they do, we want to be prepared with a vaccine advisory committee and with our own internal experts to look at the data. And the outside experts will give us their advice, and then we'll make a decision about the safety and efficacy based upon the data and science in those applications. So don't have a crystal ball, can't predict when this will happen. What I can tell you is we're preparing now, and we want to be as transparent as the law will allow us to be with respect to the data and the science and our decision making.
Yeah, that's absolutely great to hear. With your expertise, Dr. Hahn, and those of the scientists at FDA, it's essential that we hear that it's science-based, data-driven, and really appreciate the transparency as well, because I think everyone in America wants to see a healthy future here, and we know that that vaccine is probably going to be a component of that. So thank you for
Most definitely. It's our pleasure.
Yeah.
The right thing to do for FDA.
Absolutely. So with that, thank you again, Commissioner Hahn, for being with us and for taking time out of your extremely busy schedule to be with NASDA today. We really look forward to continuing to grow the very strong partnership that we have with FDA, and we stand ready to work with you at every turn. So feel free to reach out at any time. And again, thank you so much.
Thank you, Dr. Glenn. My best to everyone in NASDA, and keep up the great work.
Thank you.